Hi, everyone. So thanks for coming out tonight. This is our program, Understanding Medicare Options. So you see, we have people in the library. We also have people that are watching on Zoom. So we kind of are trying to offer our programs in a hybrid fashion. Before we get started, I'm just going to mention a couple things and a couple programs that might be of interest to you. On October the 18th, at 7 o'clock, we have a program with the Illinois Attorney General's Office about identity theft and consumer scams and how to avoid them. That's also offered in a hybrid format. On October 20th, we have a program called Jazz, America's Indigenous Art Form, and that is only online. And then on October 26th, also offered in a hybrid format, is a program called Building the Panama Canal with Gary Midkiff, who some of you might know because he's our facilitator for our Great Decisions discussion. So he's at the library quite a bit. So anyhow, for our patrons that are at home, you can still put your questions in the chat. We'll make sure that we can answer to you by the end of the evening. Mike will take questions at the end. He's going to talk, and then we'll take questions in the room, questions at home, and we'll make sure we get your questions answered. This topic, I think this is Mike's maybe 4th year doing it here at the library. Yes. So it generates a lot of questions that we've definitely learned. For the patrons that are here in the library, if you could just make sure your cell phone is on silent, we'd appreciate that. And now I'm going to turn things over to Mike Altman, who is a benefits advisor and one of our local, one of our patrons lives in our community. Yes. And I'm going to turn things over to Mike. So
terrific. Thank you. Thank you. Good evening, everyone, and welcome. I'm wondering how many of you have been inundated with calls from those pesky agents and getting all the okay. And there we think what's going again. You want me to use the hand mic? All right. Great. Yeah. Thank you.
And when you just kind of talk into it pretty
good evening once again. I don't know if this
is on, but you just need to kind of talk into it like that.
Okay.
Yeah.
Terrific.
Okay.
As I was saying just a few moments ago, welcome. And what I was really kind of asking is how many of you are getting inundated with calls from pesky agents and paraphernalia coming in the mail? And how many of you have looked at it and said, what the heck is this? This is so difficult to understand. Well, that's why I'm here tonight. I take the mystery out of Medicare. I'm on Medicare myself. I have been for 8 years. I have been an agent for 50 years. Boy, that's amazing when I even think about it. And my goal really is, again, taking the mystery out of Medicare to help you make decisions on the type of care you want so that you don't put your finances at risk. That's the whole point of this. For those who are here, there was a booklet that I had passed out. It says United Healthcare on that. I just think they have a very good booklet. I represent many insurance companies. And again, this is an educational seminar, so I'm not going to be talking about individual companies. It's not the point of this. What I am interested in is covering some of the basics regarding Medicare so that you'll have a better understanding of how it works. Medicare covers about 55 million people, and you'll have this statistic: 10,000 people turn 65 every day. That's an incredible statistic, but yet they do. And many people, they don't know exactly what programs they should go into. Again, they've been bombarded with TV ads and such. It makes it very difficult for them. So just some of the basics of Medicare. There are 2 parts that make up Medicare. It's called Part A and Part B, building blocks, if you will. Part A is for hospital expenses, hospice, skilled nursing care, and home health care. There is no charge for Part A because you've actually been paying for it. How have you been paying for it? Through taxes. Some people who don't qualify will have a charge, but if you put in the necessary hours with Social Security, there's no charge for Part A. Part B is a different story. Part B is for physician services, outpatient care, and durable equipment. Like a cane, for example, even a sleep machine. Those are a walker. Those are included in Part B as well. Now with Part B, there is a monthly cost. Currently, the monthly cost is $170.70. That's going down effective the first of the year. It's going down to a whole $5.20, but it's going down to $164.90. Now that's the minimum that you could be charged, depending on your salaries in terms of the thresholds that Medicare has developed. And Medicare will acknowledge, they'll tell you exactly what your Part B expense will be. But assuming you're at the lowest possible, that figure is $164.90. One of the other things that they've changed for Part B, again, physician services, outpatient, and durable equipment, is the fact that there's currently a $233 annual deductible. Well, that is going down. It's going down to $226 instead of the $233 effective the first of the year. And there are some other changes too that I will review with you as well. Part A and Part B make up what we call original Medicare. Medicare picks up 80% of your eligible expenses. Well, what about the remaining 20%? Well, that's why most people have either a supplement plan or a Medicare Advantage plan. And I will further explain that in just a moment. With a supplement plan, and that's offered by insurance companies, the Part A and Part B are offered by the government. So if you're looking for a supplement plan, many insurance companies offer that, and your supplement plan picks up the remaining 20%. So it is possible to have 100% coverage with a supplement plan and Medicare. Give you a personal experience. 6 years ago, I had major surgery. I had a bill of $690,000. I never paid a penny. And this is not an unusual situation. If you talk to other people who've been on Medicare, they have a supplement plan and they have Part A and Part B. This is the type of story that you will hear. And it's just, Medicare is an amazing vehicle for reducing your costs. So don't be afraid of going on to Medicare. Some people have concerns about that because it is a government program, if you will, but you can really take advantage of it and keep your resources and wealth intact by not having to spend that type of money for a hospital stay. So we have Part A, Part B. We have a supplement plan. Again, supplement plans are offered by insurance companies. They've made it pretty easy too, because there are a number of different plans that are available with supplement plans. The benefits are exactly the same for each one of these companies. Now you may be saying to yourself, well, wait a second, why? They have the same benefits, but their prices are different. Aha, it's called competition. How does an insurance company differentiate itself from other insurance companies? And one of the other things that insurance companies do, many will offer additional benefits. For example, they might have hearing aid discounts. They might have discounts for lenses and frames. They might have admission to a health club, for example. So those are the things that I talk about with my clients to help them make their decisions as well. So again, building blocks, A, B, and then we have the supplement plan. There is one of the things unique to a supplement plan. For those of you who are coming from a PPO environment, where you can go in network or you can go out of network, there is no network with a supplement plan. In other words, you can go to any provider anywhere in the country as long as they accept Medicare. And about 96% of providers across the country accept Medicare. My wife and I typically go to Arizona during the winter for a couple of months. I use a hospital out there. I have doctors out there. Now, when I'm home, I use Northwestern. So you have total flexibility as compared to a PPO where yes, you can go in network or you can go out of network. You're just going to pay more out of your pocket if you do not use their providers. Okay. One of the things, well, let's talk about another building block. This is called Part C, or Part C is for Medicare Advantage plans. How many of you have been watching the Joe Namath ad that runs across the screen? It seems like every 10 seconds. Well, those are Medicare Advantage plans. Medicare Advantage plans are either an HMO, Health Maintenance Organization, or they're a PPO, Preferred Provider Organization. They're both tied to networks, whereas the supplement plan that I just talked about, there is no network. You choose who you want to go see as long as the provider accepts Medicare. With a Medicare Advantage plan, again, they're offered by insurance companies. The thing that they don't mention in the ads, and I have some clients who have the program and they love it, but for many people, they still find it inflexible because, like for example, with an HMO, you have to use their providers in their network. If you do not, there are no benefits unless it's a medical emergency. With a PPO Medicare Advantage plan, again, Part C, the way that it works is the fact that you can go in network, you can go out of network. If you go out of network, you're going to pay a higher percentage of the cost. And the other point being is the fact that with Medicare Advantage plans, and this is the thing they don't mention in the ads, for every type of service that is rendered to you, you're going to have a copay. So let's assume you're in a Medicare Advantage plan and for whatever reason you need to go into the hospital. You can look forward to paying about $300 to $400 a day as a copay. You need to see a physician, there's a copay for that. Oh, you need x-rays? You need an MRI? You're going to have copays for that as well. Whereas with a supplement plan, it's first dollar coverage. There's no front-end deductible that you have to meet. For those of you who have been under employer plans, where they typically have an annual deductible that you have to meet before the program goes into effect. That's not the case with a supplement plan. So there are differences between the two, certainly. And one of the things, the way that I interact with my clients is to explain both pieces to that. Talk about a supplement plan, talk about a Medicare Advantage plan, so people have an opportunity to decide what is going to be best for them. In the room here, how many of you are on Medicare already? And I take it the rest of you are not yet, not yet. All right. And that's fine. One of the things you should keep aware of, if you're not on Medicare yet, you can sign up 3 months prior to your turning 65 by going to medicare.gov. You can do it right online. Now, if you work for an employer with more than 100 employees, there's a form that both you and your employer will need to complete. The form is verifying that you're leaving group coverage. If you run into a snag and your HR department doesn't have it, I have it. All you have to do is contact me. I'd be happy to email it to you. Again, Part A will come to you automatically, really, because it's always the first of the month that you turn 65. Part B, which has a monthly cost to it and an annual deductible, you decide when you want that program to go into effect. For those of you who are 65 plus and are still working, you really need to make sure with your employer that, number one, that you can continue having the coverage through their employer plan, even though you're 65. And that's an important issue behind it. Some employers require their employees who are over 65 to have both Part A and Part B. Some employers require only Part A. If you're paying for a Part B, you really should think about that, because you're not going to be able to collect under Medicare and also your employer plan. It's one or the other. So it's just something to think about when it comes time for you to go onto Medicare. It takes you about 10 minutes to enroll online by going to medicare.gov. You should also know that Medicare also has a 24/7 telephone line. I've called at night, for example, and there's always somebody there answering the phones. It's not like calling Social Security office. And by the way, that form that I mentioned, verifying your group coverage, that form is sent to Social Security, and that starts your enrollment process for Part B. Okay. One of the other areas that I find seniors have difficulty understanding are prescription drug plans. Now I'm going to introduce another building block, and it's called Part D. Part D is for prescription drugs. And this program came into effect in 2006 under the Bush administration, and it provides you with coverage so that you're keeping your expenses as low as possible. And there are 4 stages to a prescription drug plan, and it's all offered by employers, again, just as dental, vision, even travel insurance, which I do represent. Those are all part of working with an insurance company. And again, I represent many insurance companies. So with a Part D prescription drug plan, there are 4 stages. The first stage is called the annual deductible. At one time, like 2-3 years ago, there were some companies that had no annual deductible for prescriptions. Those days are really gone, especially at the price range that you can obtain a policy with. So consequently, most plans out there right now in the $20 to $30 range will have an annual deductible. Currently, the deductible is $480. Guess what? That's going up. Effective the first of the year, it's going up to $505. But what insurance companies have done is that they've made it conditional to what tier level your medication is. So if you're taking tier 1, which is a preferred generic medication, even tier 2, which is also, it's just a non-preferred generic, typically the deductible is not going to apply to that. But if you have a medication that's a 3, 4, or 5, you are going to be subject to the annual deductible. And it continues on for the year. And the next January of 2024, it begins anew. That's how that's what is considered to be the first stage of the Part D plan. The second stage is designed to It's designed that it's going to be based on what co-pays you have made out of your pocket for prescriptions. It'll also depend on how much has the insurance company paid toward this. It's called the initial stage. So it's based on those two items. Now, the way it's set up is the fact that there's a dollar threshold to it. And currently it's $4,300. That's going to go up to $4,600 as the threshold. But what happens if you go over that amount? Then you get into the donut hole, which scares most people. In the donut hole, you're going to pay 25% of the cost of the medication, plus whatever costs you had in stage 2. And now your new threshold is going to become $7,400 starting January 1st. What happens if you go over that? Can you still get coverage? Yes, you can, because the last stage is called the catastrophic stage. And in the catastrophic stage, you're going to be paying either 5% of the cost of the medication, or you're going to pay a copay of about $5 for a generic and about $9 to $10 for a brand name. So that is how it is laid out. I know it sounds confusing. And one of the things that I do with my clients, right now we're in the heart of the annual enrollment period. And this is a period of time where people can make changes to any of their insurance companies. And one of the things that I do as an agent, I work with each and every one of my clients and helping them review their current medication list to see whether or not that company that they're with is providing the type of service for the next year. Because every October, insurance companies can change their prices, tier levels, and their formulary as to what they are covering. Well, if they make a decision that's not in your best interest, you want to make a change, right? And that's what I've done 3 times over the last 8 years. It's easy to change prescription drug companies year to year. There's no medical underwriting, no questions regarding your health, no questions about what medications you're taking. It's a very, very simple process. It's a little bit more difficult if you're trying to switch, let's say you're in a supplement plan or a Medicare Advantage plan. If you wanted to switch to another insurance company for the next year, then it becomes a little bit more problematic. And many times people will have to go through medical underwriting, which is nothing more than a series of questions regarding your health, what diagnoses you may have, what medications that you have. All of that, it will go into determining whether that insurance company that you want to change to will accept you or deny your coverage. Well, you haven't lost anything, because if they deny your coverage, you stay where you're at. You haven't lost anything by doing that, but it gives you the opportunity to do that. So it's been my experience that most insurance companies are very, very strict with their medical underwriting. And that's why it can be very difficult to try to change insurance companies. The one company that makes it very, very simple is Blue Cross here in Illinois. They don't require any medical underwriting. So that's a real good insurance company to fall back on if you want to make a change. But like anything else, it depends on the prices, right? You're going to find differentiation between each insurance company as to what they charge per month, even though it could be the exact same benefits. There are different plans that are available. Plan G is the plan that most people have with the supplement plan. And it's a type of plan where, again, you can obtain 100% coverage along with your original Medicare Part A and Part B. And again, the benefits are exactly the same with every insurance company for Plan G, but they just charge different amounts of money for that program, or they provide additional benefits. It's a very, very competitive marketplace. So I would certainly encourage, for those of you who are on Medicare already and want to take a look at another an opportunity to perhaps change your prescription drug company, what I would like to recommend is for people to email me. My email address is Mike Altman. So that's lowercase MikeAltman at hotmail.com. What a clever email address it is, isn't it? In any event, if you send me that along with your name of the medications, dosage, and frequency for taking it, and indicate what plan you may be under now for Part D, that will allow me to put together a Medicare analysis. And in my Medicare analysis, what you're going to see are a number of different options with different insurance companies. I also go the extra step by taking your medications and indicating what the tier level is for that medication with each individual company. So it makes it very easy for you and for me, certainly, to help guide you towards making a decision that you're comfortable with. And that's my main point of really achieving. I want my clients to feel that they're getting the best service. For example, I do newsletters every 2 months regarding Medicare, changes that have occurred and such. That's how I keep in touch with my clients. My phone is always available, and I'm very good about responding back to people as well. So don't be shy about that. Let me give you my phone number. It's 224-999-3696. So again, 224-999-3696, and you'll be able to get me directly. Okay. Well, have I confused anybody so far? We've gone over a lot of information, and at this point tonight, we're going to handle questions that you might have. I'm going to try to come up with the answer. If I don't know it, I certainly will investigate it and get back to you. All right. We have a question right here. Get an insurance company, if you're on your plan, for example, do all their customers pay the same premium under G? A great question. It's about how are rates determined? Well, rates are determined by the sex and age of the individual. And gentlemen, men pay more than women. Or if you're the same age, males will pay more. And the thing you should always be aware of is that every year you're 1 year older than you were the year before. Therefore, you certainly should expect some type of increase from year to year. It may be minimal, but in fact, that happens. Again, you're 1 year older than you were the year before. Does that answer your question? There's no reason to change insurance company because of the premium if they charge all the customers at a given age. Yeah. Now, the only thing that is different for a prescription drug plan, everybody pays the same rate, whether you're a male or female, for prescription drugs. I was really referring more to a supplement plan or even a Medicare Advantage plan. But if you want to change your prescription drug plan, the rate is the same for men and women. In fact, whether you had one medication or you had 10 medications, the cost is the same. Many of the insurance companies, they actually have reduced their cost for their Part D prescription drug plan. There is at least 2 to 3 that have reduced their price to be more competitive in the marketplace. Okay, great question. Thank you. Yes, ma'am. Yeah, it's a Medicare B form. In fact, most employers, especially if they have a large population, they should have the form. If they don't have it, just simply contact me and I'll be happy to provide it to you. Well, again, if you want to apply for Social Security, you should go to their website and you can apply online. Some people like going there in person and doing that. If you are covered, or if you're on Social Security, your Part B premium is going to come out of your Social Security check. And they always do that. If you sign up for Part
Mike, if you could just
B,
repeat the question so that people at home can hear what the questions are in the room. There we go.
would you mind repeating it? And I'll repeat it for you. Correct. Yes. They're saying if she's still working and you sign up for Social Security and not Medicare, will they take the Part B cost out of your Social Security check? Again, it's a Social Security issue. My sense is that they would for Part B, even though you may not have signed up for Medicare. And it's the reason why I mentioned earlier to ask your employer, do they require you to have Part A and B or just Part A while you're still working and under their plan? Have I answered your question? Okay. Yeah, absolutely.
Mike, we have a couple questions
Cool.
and people. Oh, I'm sorry. I thought you were done. I was going to give you a couple questions and people that are at home.
Okay.
One person wants to know, do you pay for A and B monthly or annually?
Okay. You can, well, for Part A, there's typically no cost to it because you've been paying for it. For Part B, you can pay it monthly, depending on how you're billed. You can also be billed quarterly. So typically, most people are billed quarterly for Part B expenses. Whether you can do monthly, you would have to check with Social Security. Again, it has nothing to do with the insurance companies, strictly the government.
Okay. And there's another question from somebody at home who writes, they're working covered by company group policy with an FSA. What are the rules about stopping FSA and Medicare?
Okay. That's a different animal totally, because there are a lot of different FSA programs. You would be best served by talking to your HR department regarding that, so for you to get an answer. Again, I don't know enough about your program to be able to answer that intelligently. Okay.
Thank you.
What other questions do you have? Do you still find this confusing, or does this help to explain how it works? I mean, that's what I'm really after here. I want to make sure that people who I speak to have a good idea as to how Medicare works. We have another question in the corner. Fees? I do this for therapy, ma'am. No, to be serious, there's no charge for my services. What happens is that if I place coverage with a particular insurance company of your choosing, I get a commission from the insurance company. I work strictly by commission. I do not work for the insurance companies. I'm an independent agent. I represent my client. The insurance companies are really a means to the end of being able to provide you with services. And it's not only just medical, but I can provide dental, vision care, travel insurance. So I do all of those things for my clients. There is no charge for my services. Never has been. Yes, absolutely. That's my number one goal. I want to make sure that whatever decision you make, you're not putting your wealth or your finances at risk, and that you have a thorough understanding of the program. I think Roz had mentioned earlier, I've been doing these seminars at local libraries for years now. I sometimes get calls from people who have held on to my business card for 3 to 4 years, and that now they're nearing the age to go on to Medicare, and they'll call me. The way my business has grown is simply by referrals. That to me is the best way. Hopefully that the client that I have is very satisfied with my services and will refer me to other people who they think I can help them. Yes.
Another person on Zoom would like to know, how do I get insurance for vision and dental?
How?
She writes, how do I get insurance for vision and dental?
Oh, well, one easy way to do it is to contact Mike Altman, and I can help you with that. Again, the thing you have to remember about with dental, and one of the key points, with most dental plans that are out there, typically there's a 12-month waiting period for major services like crowns, inlays, root canals. Well, if you go to see your dentist and he goes, guess what, Mike, you need a crown. Doc, can you wait a year for this? Probably not. There are some plans out there that I do represent that have no waiting periods at all for any type of service. So when you contact me and you're interested in dental, I'm going to show you both kinds of programs that are available. And then it's just a question of you making a decision which one you're comfortable with, what rate that you want to pay, because I'll provide that as well. And then I enroll you. Most of my enrollments are all done electronically. I use my iPad, takes a few minutes, and I can enroll people right online. So it's a very simple process. Next question. Sure. I'm sorry. You want a number? Okay. Oh, no. My wife knows this for a fact. She's sitting in the back there. I'm 24/7. We are. I am. I mean, that's just the way that I've always operated for 50 years. So I don't know anything different. Okay. And if you are getting a busy signal, whatever, you can leave a message and you can be sure I will call you right back. Okay. One of the things that has changed a bit for selling Medicare programs is that Medicare is now telling all agents that we have to record every conversation that we have with an individual for prescription drugs or a Medicare Advantage plan. I don't have to do it for a supplement plan, but for the other two types of products, I have to record our conversation. And I also have to read a disclaimer to you. This just started October 1st. So I do have a service that I use for recording it. And I have to keep those recordings for 10 years. It's Big Brother is watching. But you know, that's the way that it is. There's always, look, we all know at this age, there's always change. And this is just one of them. So.
Okay, well, Mike, I think we answered the questions from the room, and it looks like we got the questions in the chat, and there was some nice compliments to your program in the chat as well. They did a very nice job.
Thank you.
As usual. And so I think we'll wrap things up, and thank you for joining us tonight, and thank you for joining us at home and here in the library, and we hope to see you again soon. So good night, everybody.